If you're like most drivers and you want to feel safe every time you hit the road, but man, here's the crazy part. Many people unwittingly make simple mistakes that increase the risk of whiplash injuries and a rear end collision. Right now it's January 2025. Man, it's Michigan. It's freezing out. It's slippery. So you got to be really cautious. In this video, I'm going to show you 5 simple expert-backed safety tips to protect yourself in a rear-end collision. Also to protect your family. You don't need any special gear. You don't need any expensive fixes. Just small adjustments you can make right now, today, to drive safer and feel more confident. Stick with me to the end, and I'm going to reveal the number one mistake many of you make after an accident that turns a small problem or minor symptoms into long-term pain and sometimes disability. Trust me, you don't want to miss this. Hi, I'm Dr. Gregory Kramer. I have over 30 years of clinical experience and certifications in chiropractic biophysics, which is the largest, most recognized corrective care facility and technique in the United States and perhaps even in the world. I specialize in treating chronic problems. In other words, chronic spine pain, chronic problems with being able to walk, such as hip problems, knee problems, neuropathy, feet. So I've been dealing with mechanical spine pain, like I said, for over 30 years, and many of those spine pain patients come from a small car accident that they didn't fix that turns into big problems. All right, I use a variety of corrective care methods. That means we do mirror image or opposite posture adjustments, exercise, traction to mold the spine to normal alignment. We use non-surgical spinal decompression when you have a compressed disc in your neck or back, or if you have a compressed disc pinching a nerve to your feet leading to neuropathy. Before I continue with this video, I need you to hit that subscribe button if you want to learn more how to eliminate pain, stabilize your body, avoid surgery so that you can live stronger longer. I usually upload a new video every week. Whiplash is one of the most common injuries in a rear-end collision. And since it's wintertime in Michigan, 2025, and it's icy, today it's freezing out, it's also one of the most underestimated. Many drivers just simply don't realize that even a slow-speed crash can cause serious neck and back pain that can last for years or potentially forever. For example, a collision at just 10 miles an hour can strain your neck. That can cause micro tears in the ligaments, the disc, and connective tissue that hold those bones together and leave you with enough lingering pain to make you wish you never got in a car. Most people believe that their car safety features protect them. But you know what? The truth is, many of these features are designed to protect the car, not necessarily your body. In fact, studies show that almost 50% of drivers injured in a rear-end collision experience some form of whiplash. The good news, with the right preparation, and that's the whole purpose of today, is to avoid. You can greatly reduce your risk. Now, here are 5 safety tips to prevent whiplash injuries. The most important is you want to adjust your headrest. That's so important. The simple tool, the headrest should be at the top of your head and close to your head. Because if the headrest is too low, when you get hit from behind, that's going to tear those ligaments, particularly if you have a long, thin neck. This really applies to women that have long, thin neck that are more at risk from a rear-end accident. Imagine if you were a wrestler with a short neck, that almost no neck, you could probably walk away with Godzilla running into your car. But if you're a woman with a long, thin neck, you're more at risk. Let me show you a picture of that. All right, so remember, if the headrest is too low, like in this one, that is creating a fulcrum where a small whiplash could tear the ligaments, can tear the disc, and leave a catastrophic problem. We want the headrest to be close to your head, almost touching, and to the top of your head. So this headrest is too low. It's hitting him just underneath his hairline, and it's too far away. This headrest also is incorrect. It's too far away. You want support. Remember, whiplashes happen in a fraction of a second. Now, this headrest is aligned to meet the center of the driver's head. So you want it close to the head, top of the head. That can potentially save your life. That could save you years of misery. So very simple. Headrest close to the head, top of the head. Now, proper posture, that's a given. Sit up straight. Your parents have been telling you, your grandparents have been telling you, sit up straight behind the wheel. That makes a huge difference in protecting yourself. You want to make sure you're not slouching, leaning forward, reclining too much. All these positions leave your neck vulnerable during a rear-end collision. You want to sit up straight, keep your posture proper. Not only improves safety, but it always makes driving more comfortable. Another simple thing is leave safe stopping distances. So, very simple. Give yourself room to move out of the way. When you pull up to a red light, give yourself some space. And then the next thing is that you want to use your rear view mirror effectively. So when you give yourself some stopping distance in front, look behind you. Don't look at your phone in this day and age. Pay attention. If you see someone coming up behind you, try to get out of the way. If you have no distance, you're not going to be able to do it. So not only sitting up straight, proper headrest, giving yourself room with the car in front of you, but you want to use your rear view mirror very effective. You want to pay attention when you start slowing down or coming to a red light. Make a habit to glance up every couple seconds when you're stopped at a light. That could save your life. Now, a common thing too is you want to avoid distractions while driving. Obviously, that's a given. Very simple. Driving should be pleasurable. Yes, you can talk to people next to you, but don't be looking at your phone. You want to pay attention. So those are the 5 tips. You can greatly reduce your risk of whiplash and drive with more confidence. So what happens when you have a whiplash is it forces your neck to go into a very fast, very rapid whiplash motion. This tears the muscles and ligaments and joints. Even a low-speed crash can cause serious injury. So we talked about the safety measures. We want to adjust your headrest, maintain proper posture. You stay alert as soon as you start slowing down, giving yourself space in front of you so you can get out of the way if something is not stopping. But there's a limit, right? So staying aware of threats behind you also gives you time to brace. Now, what does bracing mean? If you couldn't get out of the way and you see that car coming, statistically, we know that when people don't see a car coming, don't know they were going to get hit, they're worse off. Just like in boxing or in martial arts, it's the punch you didn't see that does the most damage. Same thing when you're driving in a whiplash. It's the rear end car hitting you that you didn't see. But if I knew it was coming, you're going to want to brace. You want to shrug your shoulders up. You want to tense up all the muscles to minimize head motion. All right? You want to use your muscles to stabilize your neck so the force doesn't just go to the ligaments and the disc. So again, bracing is crucial to saving your life if you know you can't get out of the way. Now, thank you for making it to the end. I'm glad I hope you like this video. I hope you like it. I hope you subscribe. I hope you share it with other people. But here's the number one mistake after a car accident that many people make. And I can say this because I've been practicing for over 30 years, and I've seen almost 300,000 different visits, different people. So the number one mistake is fix small problems when they're small. Now that sounds simple, all right? Even with the best prevention strategies, accidents can still happen. And what you do afterwards is just as important as what you do to prepare. So again, if you have a minor symptom after an accident, don't ignore it. Get it checked out. The solution is simple. Seek medical attention, even if the symptom is mild. A visit to a corrective care chiropractor can help identify hidden ligament injuries early and prevent them from worsening. And I'll talk about in the next video about the most important test. For 95% of you, the most important test is called a stress or motion x-ray. It will determine the level of ligament damage that holds your spine in place. It'll determine the level, but also the degree. Is it mild? Is it moderate, severe? And so that you could correct a small problem to prevent chronic pain and disability. So many of my patients over the years, I see them years after an accident. And originally, they ignored a small problem, a minor ache, and it turns out to lead to debilitating neck pain, pain going down their arms, headaches. It requires extensive treatment, costing them extra time, money, and energy. So if you have an injury, get it checked right away. Plus, your auto insurance typically will cover an injury that happens after an accident, but they're not going to cover it if you go seek care 2 years later. So bottom line, any injury you experience, you should get checked out by a corrective care chiropractor and ask them, do they do motion x-ray? The motion x-ray, and I'll discuss this more in the next video, is the number one most important test to determine the location and severity of ligament damage. And ligaments are what injured in a spinal whiplash. Okay, so I hope this information was helpful. I hope that you find that you never need it. I hope you never get a whiplash, but they're preventable with a few small adjustments. Don't wait for a car collision to start protecting yourself. Take action. Make these changes today. And if you found this information helpful, like I said, subscribe for more safety advice. Share with others that you could benefit. In the next video you should watch is this one, where I'm going to dive deep into whiplash injury, causes, symptoms, corrective treatment. Go watch this video now.